Hello and welcome to the training module for the Rxight pharmacogenetic test. This educational training program is brought to you by MD Labs. The learning objectives for this session are to become familiar with the science behind the Rxight pharmacogenetic test, understand the pharmacist's role in the pathway from purchase to results, and importantly, how to discuss the benefits of pharmacogenetic testing with your customers. The Rxight pharmacogenetic program is designed to be the gold standard in PGx testing. Rxight is the most comprehensive pharmacogenetic test on the market. Rxight uses DNA from buccal cells to detect the presence or absence of gene markers. These gene markers have been identified as indicators of how a person will metabolize and respond to given medications. MD Labs' scientific team uses open array technology to identify 60 alleles present on 18 genes that determine the metabolism of over 200 prescription and OTC medications. We then use peer-reviewed published clinical studies to give guidance on each medication. Results are available within 5 to 7 working days. Results are not provided directly to the customer. Pharmacogenetic implications can be complex, so when results are ready, both the customer and the pharmacist are notified via email, and the customer is directed to schedule a personalized medication review, or PMR, with the pharmacist. A PMR gives the customer the opportunity to learn from the pharmacist how their genetics will impact their current and future medication therapy choices. Conducting a PMR is covered in the next training program. MD Labs, providers of the Rxight PGx test, is a leading high-complexity CLIA-certified laboratory servicing physicians and patients nationwide. MD Labs upholds the highest proficiency standards in the industry and employs redundancy testing, which drives their test accuracy to over 99.98%. CPIC, the Clinical Pharmacogenetic Implementation Consortium, establishes and publishes guidelines that enable the translation of genetic laboratory test results into actionable prescribing decisions for specific drugs. These guidelines, which encompass both grading of evidence levels and determining how genetic test results should be used to optimize drug therapy, are published in leading peer-reviewed journals, considered the gold standard for pharmacogenetics, and are referenced by the FDA. MD Labs and the Rxight PGx test conform with the CPIC guidelines. The Rxight package is to be merchandised behind the pharmacy counter. Promotional signage should be placed throughout the pharmacy to create awareness for the Rxight DNA test for medication responsiveness. Thus, the purchase-to-results pathway begins with the pharmacy and pharmacy staff making the customer aware of the Rxight PGx program. The pharmacy staff retrieves the Rxight box from behind the counter, then completes the requisition form, which includes whether this is a cash or insurance transaction, the provider, patient, and medication information, and, if relevant, the insurance information. The requisition form should be completed online at the Rxight provider portal, but if needed, it can be manually completed using the 2-part requisition form included in the Rxight package. Once the completed requisition form is signed by the customer, the pharmacy staff assists the customer with collecting their DNA. The customer rinses their mouth with water for about 30 seconds and then uses the included OraCollect sponge to collect their DNA specimen. There is a separate video as part of this training session demonstrating how to properly use the OraCollect DNA collection sponge. Once the collection is complete, the pharmacy staff places the capped OraCollect tube into the included plastic bag, seals the bag, and places it in the cradle inside the Rxight collection box. The signed requisition form is placed in the box is closed, sealed, and then mailed back to MD Labs using the U.S. Postal Service. Once MD Labs receives the customer's DNA sample, the test is processed, and the results are available within 2 business days. MD Labs then sends an email notification to both the patient and the pharmacist that the Rxight test results are now available. The patient is directed to schedule the PMR with the pharmacist. The pharmacist assesses the Rxight report from the Rxight Pharmacist portal. If the PMR is being conducted in person, the pharmacist will provide a copy of the PMR to the patient. If the PMR is being conducted remote, the patient views the report via WebEx during the PMR session with the pharmacist. The pharmacist prepares for and conducts the PMR session with the patient. We will not go into the details now, since the next training session focuses on performing the PMR. Suffice it to say, this is when the pharmacist, following the PMR checklist on the Rxight Pharmacist portal, reviews the test results and provides recommendations to the customer. Once the PMR is completed, the pharmacist, as needed, follows up with the prescribing physicians to discuss and coordinate medication recommendations. A letter to the physician is automatically generated from the information entered on the PMR checklist and available for the pharmacist to fax to the physicians and print for the patient. Most patients are not yet aware of pharmacogenetics, especially since this is a new service offered by the pharmacy, and since most physicians are not yet discussing this topic with their patients. Thus, it is important for the pharmacist and their staff to be comfortable initiating the discussion with their customers, as well as communicating the importance and benefits of pharmacogenetic testing with their patients. Anyone can benefit from PGx. You never know who might want it for themselves or who may know a family member or someone they care for that may benefit. The customers that will be most receptive to getting tested now include those patients that you know are struggling with their medications, either due to side effects or ineffectiveness. Those patients that are apprehensive about starting a new medication due to the potential side effects, and patients that are on medications that are currently covered by the Rxight test. Additionally, customers who are caregivers for family or their elderly patients are also important customers to inform about this new service the pharmacy is providing. A good time to inform your customers is either when they drop off their prescription or when they're checking out. The pharmacist or technician can simply say, "Did you know that we can do genetic testing now?" Just using one statement can open up a conversation. Keep it simple. Don't go into too much of the science details. The likely response is, "What is that?" or "Why?" In either case, you can share that medications work differently for different people based on their genetics. And this testing can help them avoid medications that could cause bad side effects or be ineffective, reducing unneeded physician visits and reducing the expense of ineffective medications. Let them know that this testing can help make sure that they get the right medication at the right dose, getting them on the right medication sooner, which means getting the intended medication benefit sooner. Your customer will most likely ask you about the process and how the testing works. You can share that all it takes is a simple cheek swab, which you can do at the pharmacy. Let them know that the results are generally available in about 5 days. Reassure them that you will review the results of the test with them and develop medication recommendations, which you will discuss with their prescribing physicians. Let the customer know that this genetic test will provide a lifetime of benefits. The cost covers over 200 medications they may be on today, as well as those they may be on in the future. The price of the test includes the PMR and is FSA, HSA eligible. You will also most likely get different responses based on the patient's age. Younger patients may say, "Well, I'm not on anything, so I imagine this may be more beneficial in the future," or for people taking a lot of medications. Give a specific example of how a younger patient on no meds can benefit, because their healthcare providers will have their genetic information prior to any future medication needs. For instance, if they need pain medications from a fall or a muscle strain. Older patients may say, "Well, I've been taking these meds for a while, and I'm fine on them." The pharmacist can make sure these customers know that the future is never certain. No one plans to be on heart medications or pain pills in the future, and both are critically important to get right the first time. So the key points from this training session are: 1. The pharmacist needs to take the lead in opening the discussion about genetic testing with their customers. Expect your customers to be unaware and unknowledgeable regarding pharmacogenetics. While all patients will eventually benefit from PGx testing, know which ones for whom the Rxight test is particularly relevant today. Spend your time discussing the benefits for the patient, as opposed to the science, and make it personal. Rxight is the most comprehensive PGx test. Importantly, the cost includes a personalized medication review and the results are available within a few days. Finally, know the role the pharmacist plays in the process, from completing the requisition form, swabbing the patient, shipping the collection box, to performing the PMR. Thank you so much for your time for listening to this presentation. If you have any additional questions, visit us at www.rxight.com or send us an email. Thank you for your time.